Becoming a parent brings immense joy, but also enormous responsibility. In those first tender weeks and months, your primary focus is ensuring your newborn's health and well-being. While most infants develop typically, it's crucial to be aware of potential red flags that might signal an underlying issue. Recognizing these early warning signs and seeking prompt medical attention can significantly affect your baby's long-term health and development. Today, we will discuss some of the common and uncommon early warning signs or red flags that may occur in newborns and infants, what they may mean, and what to do about them. Common early warning signs. In the first few months of a baby's life, there are certain signs and behaviors that pediatric health professionals keep an eye out for, often referred to as red flags. These red flags can indicate that a newborn or infant might need some additional support or intervention. Recognizing these early warning signs is crucial because it allows for early intervention, which can significantly impact a child's development. Some of the common early warning signs or red flags that may occur in newborns and infants include fever. In this condition, the baby's body temperature exceeds the normal range, usually exceeding 100.4 degrees F or 38 degrees C when measured rectally. It can be caused by various infections or illnesses, including common colds, the flu, ear infections, or other infections. Additionally, fever can signal more serious conditions like meningitis, sepsis, or pneumonia. A fever can impact a baby's hydration, metabolism, and immune system, leading to discomfort, irritability, or lethargy. To handle the fever, it's recommended to provide the baby with fluids, dress them lightly, and use a cool compress or fan. Medications like acetaminophen or ibuprofen can also help reduce fever, but it's crucial to consult with a doctor before administering these. It's important to notify the doctor if the baby's fever surpasses 100.4 degrees F or 38 degrees C, persists for more than 24 hours, or is accompanied by other symptoms like rash, vomiting, diarrhea, or difficulty breathing. There is also jaundice, a condition where the skin and the whites of the eyes turn yellow. This happens because of a bilirubin buildup, a waste product from red blood cells. Various factors can cause jaundice in babies, like an immature liver, blood type incompatibility, breast milk, or infections. It can affect the baby's brain, liver, and blood, leading to symptoms such as sleepiness, poor feeding, or anemia. Treatment options include exposing the baby to sunlight, using special light therapy, or providing fluids and supplements. It's crucial to inform the doctor if jaundice appears within the first 24 hours of life, spreads beyond the face and chest, or is accompanied by other symptoms like dark urine, pale stools, or low temperature. A baby can also have breathing problems. Infants may experience difficulties in breathing, characterized by symptoms like wheezing, grunting, whistling, gasping, rapid or shallow breaths, and pauses between breaths. Various factors, such as underdeveloped lungs, nasal congestion, reflux, allergies, or infections, can cause these issues. Breathing problems can impact the baby's oxygen levels, carbon dioxide levels, and blood pressure, potentially leading to cyanosis, a bluish color in the skin, lips, or nails due to oxygen deficiency. Treatment options include clearing the nose, elevating the head, using a humidifier or saline spray, administering medication, or providing oxygen. It's crucial to consult a doctor if the breathing problems are severe, persistent, or recurrent, or if additional symptoms like fever, cough, or chest retractions accompany them. Also, fast or slow breathing, over 60 breaths per minute or less than 30 breaths per minute, can be a sign of respiratory distress. Identifying key indicators in your baby's growth. As a parent, you are in a unique position to observe these red flags since you spend every moment with your little one. By being aware of these signs, you can play a proactive role in your child's well-being. Some of the key red flags that parents should be mindful of during the early months of their baby's life include motor development. Red flags: limited head control. Babies should be able to lift their heads to a certain degree during tummy time and provide some support when held upright. Difficulty with head control may indicate underlying issues. Constantly turning head to one side. If a baby consistently favors one direction when turning their head, it could be a sign of positional torticollis, which may require intervention to prevent long-term complications. Flat spot on the head. While some degree of head shape variation is common at birth, a persistent flat spot on the back of the head could indicate positional preferences or, in rare cases, craniosynostosis, which requires medical attention. Decreased movement or stiffness on one side. Babies should exhibit symmetrical movement in both arms and legs. Increased stiffness or limited movement on one side may warrant further evaluation. Fine motor skills red flags fisted hands. By 3 months, babies should begin to open their hands and explore their surroundings. Persistent fisting of the hands may indicate developmental delays that require intervention. Social and communication red flags. Lack of crying to communicate needs. Crying is a primary means of communication for babies, indicating hunger, discomfort, or other needs. A baby who does not cry to communicate may require evaluation. Limited response to loud noises. Newborns typically startle or turn toward loud noises, demonstrating their ability to hear and respond. A lack of response to loud noises may indicate hearing difficulties. Lack of eye contact and smiling. By 3 months of age, babies should start making eye contact and responding to interactions with caregivers by smiling or cooing. The absence of these social cues could signal developmental concerns. Visual red flags inability to track moving objects. Babies should be able to track and follow moving objects with their eyes by 3 months of age. Difficulty with visual tracking may indicate visual impairment. Constant eye turn. While fleeting moments of crossed eyes are common in newborns, persistent eye turning may be a sign of vision problems that require assessment. Feeding red flags. Difficulty. Latching or feeding distress. Babies should be able to latch onto the breast or bottle comfortably without excessive liquid loss or signs of distress during feeding. Not latching well, refusing to breastfeed or bottle feed, weak sucking, excessive spitting up, not enough wet diapers, 6+ per day in the first week, or no bowel movements for more than 48 hours after the first few days is a red flag that requires prompt medical attention. Being aware of these red flags empowers parents to seek timely intervention if needed, ensuring the best possible outcomes for their child's development. If you notice any of these signs in your newborn or infant, don't hesitate to consult with a pediatrician or healthcare professional for further evaluation and support. Remember, early detection and intervention can significantly impact your child's developmental journey. Uncommon early warning signs. Some of the uncommon early warning signs or red flags that may occur in newborns and infants are eye problems. These are conditions where the baby has abnormal or impaired vision, eye movement or eye appearance, such as crossed eyes, droopy eyelids, white pupils, or red or swollen eyes. Eye problems can be caused by various factors, such as genetic disorders, birth defects, injuries, or infections. This can affect the development and function of the eyes, as well as the learning and communication of the baby. Eye problems can be treated by using glasses, patches, drops, or surgery, depending on the cause and severity of the condition. Eye problems should be reported to the doctor if they are noticeable, persistent, or worsening, or if other symptoms, such as discharge, pain, or sensitivity to light, accompany them. Developmental delays. These are conditions where the baby does not reach the expected milestones or skills for their age, such as smiling, rolling, sitting, crawling, or talking. Various factors, such as prematurity, low birth weight, genetic disorders, brain injuries, or environmental factors, can cause developmental delays. These delays can affect the growth and maturation of the baby, as well as the baby's cognitive, motor, language, and social skills. It can be treated by providing early intervention, stimulation, therapy, or education, depending on the type and degree of the delay. Developmental delays should be reported to the physician if they are significant, consistent, progressive, or accompanied by other signs, such as poor eye contact, lack of response, or unusual movements. Seizures. These are conditions where the baby has abnormal or involuntary movements, behaviors, or sensations due to abnormal electrical activity in the brain. Seizures can be caused by various factors, such as birth trauma, metabolic disorders, infections, or epilepsy. This can affect the consciousness, breathing, and heart rate of the baby and can cause damage to the brain or the nervous system. Seizures can be treated by giving the baby medication, surgery, or a special diet, depending on the cause and frequency of the seizures. Episodes should be reported to the pediatrician if they are frequent, prolonged, severe, or accompanied by other symptoms, such as fever, vomiting, or lethargy. Understanding what's normal, identifying what's not. Every baby develops at their own pace, so understanding the typical milestones and ranges is key. However, there are certain signs that may indicate a problem and warrant further investigation. It's important to remember that not every red flag means a serious issue, but it's always better to err on the side of caution and consult your pediatrician. Early warning signs in newborns. 0, 4 weeks old. Skin rashes. Some rashes may be signs of allergies, infections, or other underlying conditions. Grunting or noisy breathing. This could indicate an upper airway blockage, lethargy, or excessive sleepiness. Not actively responding to stimuli or difficulty waking up to feed. Missing key milestones. Not babbling by 6 months. Not sitting unassisted by 8 months. Not walking by 1 year without support. Greenish-black stool, meconium, after the first week could indicate a blockage in the digestive system. Unusual discharge from the umbilical cord or eyes may indicate infection. Conclusion: newborns and infants are vulnerable and dependent on their caregivers for their health and well-being. They may be unable to communicate their needs or problems clearly, so the parents and the doctors must watch for any signs or symptoms that may indicate a potential issue or concern. Some of these signs or symptoms may be normal or temporary, but some may be serious or life-threatening and require immediate attention or intervention. Depending on the condition and the baby, these signs or symptoms may have different causes, consequences, and treatments. Therefore, the parents and the doctors must monitor, evaluate, and address these signs or symptoms promptly and appropriately to ensure the health and well-being of newborns and infants